We're going to ask men to participate who have had an elevated PSA blood test, who have then gone on to have a MRI of their prostate, which has shown that there might be the possibility of prostate cancer. And these men have been advised to have a prostate biopsy, which is targeted to the areas of suspicion and also some non-suspicious areas. Why is this important? Well, it's important because in the past, we've based all of our risk models on the so-called TRUS biopsy, the transrectal ultrasound-guided biopsy. This is a random test, and so often it was very inaccurate in diagnosing prostate cancer. It often missed important areas of cancer, and when we did find cancer, we didn't know the true risk that that man had of subsequent progression of the cancer or recurrence if they had treatment. So as a result of the inaccuracies of the TRUS biopsy that we've been using over the last 3 or 4 decades, we now need to reimagine or redefine what risk of cancer is for each man. And that's because MRI is much more accurate. We can see whether a man has a suspicious area, and we can place a needle much more accurately into that area of suspicion. In addition, we would like men to allow us to take additional samples of tissue from those areas so that we can run very deep, very detailed genetic testing and other types of tests on that tissue, as well as look at the biomarkers that might be present within the blood and the urine. We will then run some very detailed analyses of the imaging that you've had, the MRI scans. We will then put all of that information together to help us redefine new risk groups that are based on much more accurate testing. What we would also like you to do is allow us to follow you up over the long term. Now, this will mean that we will track your clinical progress through remote tracking through the NHS databases and NHS Digital. This will allow us to collect healthcare information and what happens to you over the long term without necessarily disturbing you or approaching you directly. So we can then look at whether there are any particular areas or parameters or characteristics of your original prostate cancer that might predict whether one man versus another is at higher risk of progression if they were on active surveillance for their cancer or recurrence after cancer treatment. So this study will allow us to reimagine or redefine what cancer risk is for men with prostate cancer. It will be a fantastic, unique opportunity to start again and help men with prostate cancer over the next 10 to 20 years.